Cassie DeWalt. I'm a advocate for mental health and inclusion. I'm a consultant advisor to executive teams, startups, and digital health, mental health specifically. But I do it all with a fashion background, which is quite unusual. Um, but yeah, I'm happy to be here and excited to talk more about technology and how it's affecting healthcare, mental health,
Mhm.
and providers, payers,
And
patients,
everyone in between.
and everyone in
And
between.
and as you touch on, I think what's really funky is this fashion to health. And typically, I mean, I know we can touch more on how you're kind of combining those worlds, but that seems like such a leap. How did you go from your interest in fashion to get into this health world, which typically is difficult to get into, very messy because payer providers, users, everything in between? How did you begin that journey? And was your intention always to fall into health, or did you, as you know, in the start, just fall into it magically almost?
I love the word magically, so I'm glad that you got that in there. Um, but yeah, I joke a lot that I'm like the Elle Woods of mental health because she had a fashion background and then became a Harvard trained lawyer. Uh, I'm quite different because I'm obviously not obviously, but I'm not a clinician. But I've always had, and I feel like we've talked about this before. Um, I've always had a genuine desire to help people. That just translated from helping people with their outfits to helping them with, um, access, quality outcomes, etc. And so, no, it was never the plan to get into healthcare. Growing up, I was afraid of blood, and I really never knew exactly what I wanted to do. And then in school, I studied fashion and I'm from St. Louis, Missouri, and my whole family's there. I tried to live in New York and then I got homesick. And so it, retail ended up being like where I ended up in terms of fashion, working
Mhm.
at Saks Avenue. I won't tell you like the whole story trajectory of every company I went to, but ultimately I got tired of retail hours and I remembered when I was working at Saks, some of the people that came in said that they worked in healthcare sales and, early 20s. I was like, okay, I can sell something that will help people. And then maybe one day I can shop at Saks too. So that was my reasoning. But always stemming from helping people. And then I got into, I just applied to random healthcare sales roles. And then there was a medical device manufacturer that had been around for 50 years. A new VP had come in to do a turnaround, and she took a chance on me. And I'll be forever grateful for that opportunity. I think I reminded her of her daughter at the
Mhm.
time. But it was a small office of like 10 women in Kansas City where I was living at the time. And the company was, it's called Brown Mad, and they are like a class one
Mhm.
device manufacturer. But we they created everything from like cast covers and finger
Mhm.
splints to mom and baby products to arthritis gloves and private label for different retailers and lots of different things. So I learned a lot about different specialties right off the bat, and then working with different types of customers like large retailers, large grocery distributors, and Amazon, of course. That's when like
Mhm.
everyone was going to Amazon to get their healthcare supplies. So that's really what got me so interested in technology, focusing so much on Amazon and how people were buying, and the product development side of things, and looking at things from a strategic lens, and then going
Mhm.
to all these different conferences. I just loved meeting people. Surprisingly, working with a large retailer like CVS and Walgreens is very
Mhm.
similar to working with a large health plan. Lots of
Mm.
you have to talk to lots of different
Yeah.
stakeholders, and most importantly, you have to like be valuable in how you're
Mhm.
telling stories through data. You can't get a product on an end cap at CVS
Mhm.
without telling a story with data, a powerful story. And so very similar to working with a health plan. It's also been very fun to see the full circle moment in terms of the care delivery model and
Mhm.
retailers getting into, healthcare care delivery
Mhm.
and enabled care, CVS, Aetna, and One Medical, Amazon. So that's been interesting. Even large grocery. I run into buyers at the health conference that I sold to when I worked
Mhm.
there, like grocery buyers. So
It,
um,
it's so
yeah.
wild how you're touching on, like, everyone's kind of dabbling their toes into health more and more now. And which is really interesting in health. I found health obviously a little bit more old school in the sense of, because it's a larger system, things move slower just for security reasons and just adoption of any big system. I think any industry that's massive typically takes some time to transform. But what you're touching on is, conferences being quite popular, a lot of face-to-face interactions. What's really interesting I found is, obviously, with the push of AI, everything is automate, automate, automate. Yet more and more now I'm seeing this idea of going back to this in-person human to human connection. And one
Mm,
thing, when I was a wee lad, one advice I got from my father was, he said his best role he ever got was working at Harry Rosen selling suits, because of the communication, being able to work with different clients, especially in a professional manner, and just be able to talk. Do you find now, especially with working in this, like, how do you balance the idea of, okay, we need to automate everything, but then bringing that human connection? Because in health, humans, like you said, selling the story and being real to some extent still plays a lot of role. How have you been able to, or at least thought about combining, these cool technologies with realizing at the end of the day, humans might just want to talk to humans?
yeah. So I'm so glad you mentioned that too. And I know I'm taking a long time telling the story of how I got into mental health, but I think we'll get there by the end of this
Mm-hmm.
conversation. Um, but a big part of that, and I think what makes me successful in what I do in mental health is
Mm-hmm.
lived experience.
Mm-hmm.
And what makes the other founders and the other folks that are working in this space and working in healthcare, not just mental health specifically, having a unique understanding of the healthcare system from lived experience, whether that's having a family member that, I mean, we all have had
Mm-hmm.
family members, unfortunately, that have, been in the healthcare system. Um, but when it's directly impacted you, when you've seen the problems and faced the delays and the
Mm-hmm.
frustrations, and that's what helps drive you, that creates a unique opportunity for innovation and for making things more human and having that understanding that we are working with patients at the end of the day. I want to also add not just lived experience, but also it could be someone who is working as a
Mm-hmm.
provider. So that is something that personally I will not consult for a company
Mm-hmm.
or work at a company where the founder doesn't have lived experience or doesn't have someone in leadership that is a clinician.
It is wild how many organizations now, especially in health, don't have any clinical oversight. And I think it's one of those challenges where, and I've been in the same thing, trying to found things myself, working for startups, where there are a lot of broken things in the system. And a lot of times I'd say, like, the understanding could be incorrect. Things are the way they are because they're just the way they are. But there comes the point, especially within healthcare, where where you need that experience and you realize, oh, that is why you need to have clinicians on the board. You need to be part of have clinicians within the process, just because certain things don't make sense, but there are certain things that do make sense. And there's a reason why, through lived experience, through why system was set up for it to be like that, and having that knowledge is so impactful. I think we're seeing that more and more, where we have that growth of AI tech in health, and then health tech trying to get into AI. We're having this convergence where industry knowledge is kind of catching up with the technology, and then technology is also realizing they need some industry knowledge, and we're kind of getting that messy middle now. We're seeing kind of what is that perfect combination, because
Oh,
purely
yeah.
on one side doesn't work. So there is a hodgepodge together that could be more effective for helping that grow, for sure.
We certainly are in the messy middle. I was listening
Mhm.
to a webinar yesterday and that was mentioned. And I think too, the fact that I was working somewhere where there were so many different kinds of
Mhm.
specialties helped kind of drive that idea too, because you can't
Mhm.
just copy and paste a successful playbook in
Mhm.
healthcare. You can sometimes, but when it comes to mental health, you certainly can't. because there are so many complexities. And even within mental health, there are different specialties. So it is, if you don't have that unique understanding and you're just throwing money at a problem and copying and pasting
Mm-hmm.
something that has been successful before, unfortunately, that has happened more times than not.
Mm-hmm.
I've seen that. And so, um, but I think when you do have folks that are, at the table and
Mm-hmm.
working, executing, that do have lived experience and that do have that unique understanding. And if they don't, being open to learning,
Mm-hmm.
as long as you're open to learning and open to pivoting, I think that's really important.
Mm-hmm. I think when I work with a lot of startups, I think the big thing is that one question they'd always ask is like, why you and why now? And the why you is so important. And a lot of times the why you is whether it be a lived experience or having some set of knowledge which is new to the industry. And I think that's why it's so important oftentimes, because I think if there's opportunity or also realizing as yourself, why can I solve this problem where no others can't? Maybe it's because of past experience. Nine relates to feel about something else where you could bring it over. The classic example is how DNA was sequenced or was, model was figured out because those people who weren't in the field realizing, okay, I can take some knowledge, industry knowledge and bring it over here. So
Mm-hmm.
I think that's always the challenge when it comes to anything, being able to move fast without breaking things, because you can't break things in health just due to the fact that people's lives are involved. How, when looking at all these new incumbents in the market, how obviously you said, okay, looking at, who they have on their board, kind of part of the team, is there anything that when you hear from a new company or tool that when they say something that really resonates with you, you realize, okay, they get it? Anything come top of mind when you with whether it be not a slogan, but type of messaging when you makes you think, okay, these people understand the problem and might be successful. Here's anything that comes to mind, especially because there's these new companies and tools coming out all the time. Some are successful, some don't make it past a few months.
Definitely. And it's hard to, you know, gauge that,
Mm-hmm.
especially when you are like, we are so
Mm-hmm.
genuinely interested in unique
Mm-hmm.
and innovative technologies. When we see something cool, we think, oh, they must be successful. But obviously, lived experience and, clinical leadership is one thing. For me personally, there's two other things that if I hear that a company is including that in their strategy
Mm-hmm.
or go to market, I'm like, okay, this is a no brainer. This is a company that I'm going to keep in mind as I'm, helping
Mm-hmm.
connect the dots. Um, One of them is incorporating cultural competency in their model,
Mm-hmm.
clinical and tech stack. So thinking about how to truly meet people where they are, training the AI models in a competent way, in quality, like having a focus on quality. That's thankfully becoming more like custom in terms of
Mm-hmm.
different companies' strategies. But I also seeing what companies that company is working with,
Mm-hmm.
those are usually like ding ding ding, this is a winner, this is a company. Like
Mm-hmm.
the more I'm connecting the dots, the more I'm like learning about a new company and seeing, oh, this person has worked with this person in the past, or this company is piloting with this plan and they're, piloting
Mm-hmm.
with this system or this other digital health company. When those things align, um, it's really encouraging. So yeah,
Mm-hmm.
those,
And I
those are
think I think that makes I think that's a common thing. It's almost that social proof of like, okay, not who do you know, but also who you're working with. Because like you said, there's so many things adjusting, adapting every week. There's a new tool or new idea or new approach, new AI model. It's figuring out, okay, well, if they've been able to convince a larger incumbent or an individual, there's just some social proof. Doesn't say you can trust or, I mean, people make mistakes, organizations make mistakes, but at least now there's some of those kind of checks and balances in place. Okay, they're working with this larger health network. Okay, there probably were some due diligence. There was maybe something here. Let's spend more time investing in. And I think that's what's very challenging, I think, for new businesses as well now, is because so much growth is happening. It's very hard to stand out. unless you have those connections. And get those connections, you mean to have, it's a classic experience. Your first job out of school, they need 10 years of experience for an entry level role. How do you get those 10 years of experience? Because it's this endless cycle. I think that's the hardest thing to break through.
Yeah.
But obviously, if the product's good and the passion is there, success rises to the top, and people want to be part of rocket ships and a part of things that work. And I think that's the biggest thing, is getting a few wins can really start snowballing it. Obviously, as we've talked more and more over these years, one thing you're doing really interesting is kind of bringing fashion back into health. And for me, that was brand new, that fashion and health can really be intertwined, especially with kind of what you've worked on. Love for you to expand more on how you came up with this idea, how you're now bringing, like everyone else in life, the classic thing is like, how do you bring your passions back into your work? And now you've been able to combine them. How are you able to bring fashion into the health space, and kind of what are you working on these days? I know we've talked about Love Bowl in the past, being able to build stuff, and I feel that's really empowered people like us more on the business side to move quicker and also kind of build those proof of concepts. So love for you to share some of your experiences on that, just because that's really cool what you're working on now.
Thank you. And yeah, it kind of circles back to how I got into mental health in the first place. I was always volunteering at a community health center, like as I was working from fashion to medical sales. And then when I was leaving medical sales, I was interviewing at lots of different types of organizations. I ended up, it was like right before COVID, and I ended up like interviewing with a startup and a larger healthcare system. And of course, I, picked the startup. And at the time, I had one of my brothers was in the hospital for a suicide attempt. And so thankfully he was okay. But it really when you say the word passion, fashion's where I started, but passion is really what I found in working in mental health, because it all just clicked and made sense to me, because it was something that just felt so true. And the more that I learned and the more that I connected with different types of organizations within this space, the more I just started thinking, how can I connect the dots in a meaningful way so everyone can show up as their true selves? And thinking about social determinants of health. And I was at a behavioral health tech conference, the behavioral health tech conference, the best one ever that happens in the fall. Everyone should go. Salome Tibu's Going Digital Behavioral Health. It's the best. I was at that conference in an Uber on the way to Backpack Healthcare's house party. And as you do in an Uber, start talking about social determinants of health. We started thinking about and talking about clothing and things that Medicare has paid for in the past. And the more I really thought about it, the more we were talking about, why isn't clothing a social determinant of health? Food is, transportation is. You can't leave your house and go anywhere without clothing. So, and having the understanding of fashion and fashion psychology that I have, I just started thinking, there are certain pieces that you can wear. There are certain fabrics that you can wear. There are certain colors you can from, certain tips and tricks and, psychoeducational tools that you can use day to day to help improve how you show up every day. And then I started thinking even more about the different specialties that it could help impact, like the LGBTQ plus community, the perinatal maternal health community that we were just talking about, neurodivergent community, that I recently was diagnosed later in life, hence lived experience, but and also the SMI community. So really thinking about, how people show up day to day, what are ways that we can help increase access to those tools in a sustainable way. And so ever since then, I've been working on strategizing how to do that in a sustainable way. And that's how Joxie was born. And that is, we've created a 18 question assessment that helps identify different tips and tricks and psychoeducational content that we can share with the patient. It's all clinically validated. And we have an algorithm that will help pinpoint specific style profiles and send that to the patient through neurostyling. So just creating a whole entire new
Yeah.
category within care and a new modality. But certainly making sure that we have clinicians that are helping
Mhm.
impact, influence those things.
And that's so cool and so exciting. So in my world, being in health, I never even considered, even knew that as an option. Yet it always ties back to, it's the same thing when I was working in mental health. The first thing a therapist would say, or then with the therapy, would be like, okay, how are you eating? How are you sleeping? Are you being active? And you're like, well, how does that relate to my mental health? And it's, everything's interconnected. Everything is
Mm-hmm.
interconnected. And a lot of times, certain things you don't think play a big factor can play a massive factor in your mental health and especially your journey from there. And I think that's what's so cool about it. And again, everyone's lifelong dream is bringing in your passions into the work you do. And oftentimes it's in the most unique ways. Obviously, what's really interesting is you've been able to set this up, kind of do this. And as wrapping up the podcast now is, other people who might have similar passions, but, this the fear of, well, I don't know how to build a website. I don't know how to do this.
Right. Yeah.
How do you kind of break through that? Because I think that oftentimes will prevent someone from doing something, especially when it's developing a product or doing something. Is, well, I don't have the expertise. How did you get past that fear? But most importantly, start testing and building to kind of take ownership of the success in your own hands.
Yeah, well, I have you to thank for that because you showed me Lovable. And truly, yeah, when we talk about democratizing like
Mhm,
entrepreneurship, that is such a amazing tool, especially for someone like me who doesn't have a, you know,
mhm,
engineering or tech
mhm,
background, to be able to have an easy way to create a website. I actually shared it with a therapist that I
mhm,
know who was reaching out on Facebook asking for website advice.
mhm,
I've been able to create my
mhm,
business website, my assessment website. I'm working on the app version as well. And then I also used it to create my consulting website too, because since I, am curious, Cassie,
mhm,
like I like to say, I love connecting the dots. I love learning about these new innovative companies. I just organically started consulting for
mhm,
them. And then um, that has just kind of
mhm,
snowballed into Positively Cass, which I used Lovable to have a Shopify
mhm.
integration. And now anyone can go on my website and buy one of these cute little mugs.
It, I think that's the biggest thing. So democratizing access, because I think there's two things I found with AI is one, it allows you to do a lot of things, but it's also still work. And I think that's what the not the
Mm,
challenges, but it's the over optimism. Like, well, they just build everything for me. And then this is something I always tell people. It's like, well, what do you want to build? And they're like, I don't know. So well, that's your first challenge here. Is like, what do you actually want to do? And I think that's what's so cool that gives you the power. So when you are passionate, when you have a focus, the world's your oyster, and
yeah.
moving quick. And I mean, that's the
It
same
is
thing.
still
I did
work
the same thing.
though.
Mhm. It
Sorry.
is still work. That's the thing. It
It's
is
still
still
work.
work. And I think
You have to check
that's why a
it
lot of these
yourself.
projects fail,
Yeah.
because it's the iteration. You're like, I want to do this. And you're like, oh goodness, I have to answer these questions. But if you have if you have the will, nothing is, the class is saying nothing's impossible. Like if you
Yeah.
believe hard enough, you can do anything. And that has always been true. But now the ability with a passion is just a lot easier to achieve, in the sense of you don't have to become a, I knew people who are founders who learned to code over a year to build their
Mhm.
product. Now that gap is much shorter. It could be a weekend using these vibe coding tools to at least get the MVP. I think that's the thing, at least to get
Mhm.
something up and running, tested and shipped. And I know with Lovable, the Shopify store, you could launch in a day and actually start shipping. So that's so cool, especially for getting content out there. But yeah, as we wrap up here, if people want to learn more about you, more about your story, more about your websites, kind of how do they get in contact, how do they reach out, and where should they look for you?
Oh, thanks. Well, they can go to positivelycast.com. That's a great place just to learn a little bit more about me, the companies that I've worked with. And I'm also on LinkedIn too and Instagram, Positively Cast. And I'll be posting more about Joxie, and I can share that website too if anyone's interested. We're not at a point yet where we're doing a full launch, but not quite in stealth mode. I've never really been a huge fan of the stealth mode. It's not that it's a bit, it's not a
Mhm.
secret. But at the same time, I want to make sure that we just recently launched last month, so I want
Mhm.
to continue to pilot. And if anyone is interested in taking the assessment, I can share some discount codes.